I thought what I would do first of all is just give you an update of where we are with results of our overall vaccine program. I think you know that we have, for our primary series, got really extraordinary results in our province, with 93.8% of our eligible public, 12 and older, having received their first dose. And 91.2% have received their second dose of vaccine. So this means that 91.2% of those who are eligible are actually fully vaccinated. And this is something, as Dr. Lavoie has referenced, is really a remarkable level of protection when we look at jurisdictions across the world. We started our first booster program, you'll remember, back in October. We started out with the most vulnerable first. And if you look at all the people eligible for vaccination, 59.5% of those have received their first booster. And if you look at the people that actually were fully vaccinated, it's actually, of all those, because you can't get a booster until you've had dose 2, it's up to about 66%. So 66% of the people that got their primary series have actually taken the opportunity of their first booster back through November, December, January, February, and they're still coming. But I just want to draw your attention. There's still 1.3 million people who haven't yet had that preliminary booster. That's very, very important, because that means that if they've only had dose 1 and dose 2, yes, they've got a good level of protection, but they're starting to get too far away from those doses, and they need to get that first booster. And we're ready for them at any time. And I just want to mention that some of them have wanted to try some of the newer vaccines, the Novavax. Some are interested in Medicago, and we are working hard to make those vaccines available. Novavax has been in the province now for a couple of months, and we are matching people up with our pharmacists around the province. If they want Novavax as their booster dose, we're trying to enable people to get what they want in order to get them that booster. So to the 1.3 million out there today, if you haven't had that first booster that we started back last fall, please go and get it from your local pharmacy or from one of your health authority clinics. And as Dr. Lavoie mentioned, we started what was called the Spring Booster Program that was, as NACI advised us, focused on more vulnerable groups and people over the age of 70. And at this point, of the people that were eligible for that, 64% have taken it up. And that's a reflection of, we know the older people and the people with conditions that immunosuppress them, they're keen. They really know they need protection. We know that the risk of COVID and poor outcomes is related to age primarily, and other conditions where your immune system is not active. So it's not surprising that we've had that level of uptake so soon. But again, there are still over 200,000 people who have received an invitation for this spring booster who haven't yet taken up that opportunity. And we really encourage those people, because they're the group that our advisors, our scientific advisors at the national level, NACI, has said, you need this protection.